Dear brothers and sisters, today I would like to share with you another successful upward patellar fixation surgery that we recently performed in the field. Before the operation, you can clearly see that the cow was unable to walk properly. She could stand only for a short time and would immediately sit down. The owner contacted us again and again, deeply worried about the animal's condition. This disease is quite common in cattle, and once it progresses, the animal often stops moving almost completely. In this case, the cow was also pregnant, which made the situation even more sensitive. When we arrived at the farm, the owner told us that some local treatments had already been tried, but none were effective. After careful examination, we confirmed that it was a clear case of upward fixation of the patella. In this condition, the kneecap becomes locked in an abnormal position, preventing normal bending of the leg. Without proper treatment, the cow would not be able to walk, graze, or maintain good health, and her condition would continue to worsen. After explaining the problem and the surgical procedure to the owner, we prepared for the operation. The surgical site was thoroughly cleaned and disinfected to maintain hygiene. Local anesthesia was then administered to ensure the cow did not feel pain during the procedure. Although the setup was simple because it was a village environment, we strictly followed proper surgical principles. Both hind legs were affected, although one leg was more severe than the other. We carefully identified the ligament responsible for locking the joint. The success of this surgery depends entirely on precision. If the ligament or surrounding structures are damaged incorrectly, the cow may lose the ability to walk permanently. With patience and steady hands, the ligament was isolated and carefully released. Once the joint was freed, we immediately checked the movement. As soon as the leg moved freely, we knew the surgery had been successful. After completing the procedure, antiseptic medication was applied, and the wound was properly dressed. The cow was kept in a clean and dry place to reduce the risk of infection. Within a short time, she began to stand, and soon after, she started walking normally again. It was a truly rewarding moment to witness such rapid improvement. The owner was extremely happy and surprised by the quick result. From being unable to walk to moving comfortably after surgery, it was a great success for everyone involved. The cow appeared calm, comfortable, and free from pain. We advised the owner to monitor the cow closely for a few days, provide soft bedding, and prevent slipping on hard surfaces. Proper nutrition, antibiotics, and pain management were also recommended to support recovery. In most cases, significant improvement is seen within 1 week, and full recovery occurs within 2 weeks. This type of surgery should always be performed by an experienced veterinarian. Incorrect technique can lead to serious complications or permanent disability. Our goal is not only treatment but long-term animal welfare. If you enjoy watching real veterinary field cases and want to learn more about animal health, please like, subscribe, and stay connected with our channel. Thank you for watching and for supporting veterinary care.